Okay, let's dive into a topic that's incredibly complex and, for many, deeply personal. It's something that affects millions of us, but what if the story we've all been told about it is built on a shaky foundation? Just to give you an idea of the scale we're talking about, in England alone, about 1 in every 6 adults takes an antidepressant each year. And a lot of them do it because they believe they're fixing a problem, a chemical issue inside their own brain. I mean, we've all heard this, right? It's a simple, pretty reassuring story. It makes sense of a really confusing and painful experience. But what happens when that story starts to fall apart under the weight of scientific evidence? That's the huge question we're going to tackle in this explainer. We are going to walk through the research that really challenges this long-held belief and what it all means for how we think about and treat mental health. So first things first, let's get right into the heart of it. This idea, this myth of a chemical imbalance that has completely dominated the way we talk about depression for decades. And you can't overstate how powerful this narrative has been. We're talking about an overwhelming majority of the public, somewhere between 85 and 90%, who believe depression is caused by something like low serotonin. And yet, here's the bombshell. A huge, groundbreaking review in 2022 looked at decades of research. We're talking studies involving hundreds of thousands of people, and concluded there was simply no convincing evidence to support the serotonin theory. That is a massive disconnect between what the public believes and what the science actually says. And look, this isn't just some fringe critique. The major psychiatric institutions themselves are starting to walk this back. The Royal College of Psychiatrists, for example, now admits that the old narrative was, at best, a significant oversimplification. The damage from this myth goes way beyond just being misinformed. It can lead to something that's been called identity colonization. That's when this idea that you're chemically broken literally reshapes your sense of self, making you feel like you're fundamentally flawed and can't possibly be okay without a pill. So if these drugs don't fix an imbalance, the next logical question has to be, okay, but how well do they actually work? So just how effective are they? Well, when you look at all the data, it turns out that for every 7 people treated with an SSRI, only 1 of them experiences a benefit that's actually from the drug itself, beyond what you'd get from a placebo. Just 1 in 7. Landmark research by Irving Kirsch, who used the FDA's own data, really drives this home. On a 52-point scale used to measure depression, the average improvement from the drug compared to a sugar pill was just 1.8 points. Now, to be considered clinically meaningful, a difference you could actually feel, it would need to be at least 3 points. That's why this tiny difference is often called statistically detectable noise. What that means is, sure, you can measure it with a sensitive instrument, but in the real world, to a patient or their doctor, that difference is so small it's basically imperceptible. It's just noise in the data. And this disconnect shows up everywhere. In those tightly controlled trials, 82% of the antidepressant's effect is also seen with a placebo. And in the biggest real-world study ever done, the STAR-D study, the number of people who actually got better after trying their first drug was described as, quote, miserably poor. So when you combine that powerful but false story with the reality of such modest effects, you can see how people get stuck. They fall into a kind of paradigm trap, where a treatment that was supposed to be short-term becomes a reality that lasts for years or even decades. This metaphor of a serotonin-shaped key is just so perfect. It sounds so simple, so hopeful, like you finally found the one thing that will unlock your life. But for many, that key ends up locking them into a kind of pharmacological prison, a treatment plan that never really changes, even if it's not really working. And what's happening in your brain during all this? Well, it's not passive. It's smart. It fights back to maintain its balance, its homeostasis. It starts producing less of its own serotonin, and it pulls back its own receptors. The scary result is that, over time, a person could end up with a serotonin system that functions at a lower level than before they ever started the medication. And that long-term adaptation, that rewiring of the brain, is precisely what can make trying to stop these medications such a profound and serious challenge. We now understand that about half, 50%, of all people who try to stop these drugs will experience withdrawal symptoms. And this isn't a fringe idea anymore. Major bodies like NICE in the UK now officially acknowledge that these symptoms can be severe and can last for months, or in some cases, even years. And this is why our whole approach to stopping these drugs has to change. The old way, just cutting the dose by the same chunk each time, what's called linear tapering, we now know that can be really risky. The modern evidence-based approach is called hyperbolic tapering. It means the dose reductions have to get smaller and smaller and smaller as you get toward the end, because that's when the brain's receptors are most sensitive. So, after all of that, where do we go from here? Does this mean there's no hope? Absolutely not. In fact, all of this difficult evidence points us toward a more honest and, frankly, a more hopeful vision for what mental health care can be. This new path demands a really fundamental shift in how we see the problem. It's a move away from just tweaking synaptic currents and towards something much more profound, a holding of a soul in crisis. It's about seeing the entire person, not just a collection of chemicals. And what does that actually look like in practice? Well, it's built on a few core pillars: a real, robust, therapeutic relationship, taking time to understand a person's unique life story, putting things like therapy and social support first. And yes, medication might still be a tool in the toolbox, but it's a tool, not the master solution. And above all, it means empowering people with truly informed consent. And there's actually a name for all this. It's called evidence-based humanism. This isn't about being anti-science. It's the exact opposite. It's about integrating the absolute best, most critical scientific evidence we have with a profound respect for the complexity, the dignity, and the humanity of every single person's experience. And ultimately, I think this is the real takeaway. True psychiatric care, true healing, isn't about promising a quick fix and a pill. It's about offering a genuine partnership in the healing process, a partnership that's honest, that's based on evidence, and that is profoundly human. So I guess the final question for all of us is, are we ready to build a mental health care system that actually embraces that kind of partnership?